Dr. Bizrah, as I've seen on your Instagram page, you've treated numerous of patients for revision rhinoplasties. These cases or these patients, they've had unsatisfactory results elsewhere, then they've come to you to have a secondary or even a tertiary rhinoplasty. Could you walk us along that treatment?
Well, I mean, revision rhinoplasty actually is quite a very large and branched subject. Because, I mean, we have to assess is the problem is, patient complaint resulted from minor problem or a major problem. Because there are something called secondary procedures following rhinoplasty or something called full revision following rhinoplasty. So usually patient with, for example, difficult noses, very wide noses, sick skin, very sick skin, may require a small secondary procedure following surgery, about 9 months to 12 months. If they have an obvious problem. And these usually secondary procedures are very easily managed by the same surgeon who did the primary surgery, because it is, first of all, unexpected, and patient being usually informed about it before surgery. And usually very minor. It's not due to any loss of tissue or any destruction procedure. It's caused by something we call the healing problem, because in after any cut in the body, anywhere in the body, not only in the nose or in the face or in the hand, in the breast, in the tummy, abdomen. After any cut, there's always a healing process, and this healing process involves fibrosis, scarring, and wound contraction, which takes place in the surgical field up to 2 years. Continuous fibrosis and scarring. So this may show with some very minor defects, which can be very easily corrected in something we call a secondary or a follow-up procedure, usually done in the office, in the clinic, and the local. It takes only 5 to 10 minutes. So this is something related to the primary surgery, expected in some cases, and usually patient informed about it. Now the second important thing is when you have a loss of tissue. A poorly performed rhinoplasty by an inexperienced surgeon. This is where now we need to revise fully the procedure and consider reconstruction, because in most those cases there's loss of tissue, there's loss of cartilage, or maybe loss of bone. So maybe an over reduction of the hump, so the bone being lost, or over resection of the cartilage, which causes severe asymmetry, collapse of one side, deviation. So in this situation, we need to replace the cartilage which been lost because of the primary surgery, which been done by an experienced surgeon. So our option is to borrow cartilage from the ears, or have something called a homograft, which we get from donors. Usually we use the homograft mainly on the dorsum, and but on the tip, columella, it has to be the patient's own tissue, because actually in most of these patients there is no adequate cartilage left in the nose to use. Usually in the primary procedure, we construct the tip with cartilage from the patient's own nasal septum.
Or from the nose itself?
Yeah, from the nasal septum.
Okay.
But most of those patients in revision surgery, the cartilage already been used in the first primary surgery, so there's no enough cartilage left inside the nose, the nasal septum to use. So we have to go to the ear, maybe 1 ear or 2 ears. But usually when you borrow any cartilage from the ear, it doesn't show.
Does that affect the shape of the ear?
No, it never affects. When done in very professional and skilled manner, it doesn't affect. Even patients sometimes they don't notice something being taken from the ear.
Fair enough.
So we have in this situation when we need to do a full revision of surgery, we need to reconstruct the nose by replacing the lost cartilage and the lost bone and achieve more straight nose and more symmetrical nose and more balanced nose. So therefore, I mean, the patient expectation in this full revision, which has need reconstruction surgery, should not be very high, because the patient should understand the surgeon is not doing only a cosmetic procedure. He is first correcting the mistakes of the previous surgery. He is rebuilding the nose again and reconstructing the nose again in order to achieve symmetry, straight nose, and nice profound projected nose. So it's a very difficult job. So the surgeon is challenged by three things: the loss of cartilage, loss of tissue, the fibrosis and the scarring in the nose, and also the patient's psychological image in the patient, especially is depressed and happy, and usually he need time to trust the
healing process,
the surgery again. But of course, I always say it's the patient. It's really it's the mistake of the patient, because when you go to have a surgery on your nose, because the nose is the most obvious organ in the body,
middle of the face,
and the most the most important cosmetic procedure, because other procedures are hidden. Breast, abdomen are all hidden. The nose, face, and the eye are the most obvious procedures. You should choose the right surgeon, the most senior surgeon, the most experienced surgeon. Unfortunately, patients follow the prices. You are not going to supermarket to buy a small item from, so I look for something cheap. You are going to have a surgery on your face.
I understand.
So so you should really look well, search well. Don't just follow social media. Some surgeon with no experience and trying to do some just funny behavior on the social media to attract patients without any strong academic or professional background. So I say it's a patient your own mistake. Don't to blame the surgeon. You follow this position because of the price mainly. So there's nothing called cheap in surgery. And cheap means no experience, means low standard of materials being used during surgery. Because the materials are expensive, the hospitalization is expensive. So when you go for something cheap, it's always on the patient safety, against the patient safety. Okay, I'll give you an overall view of this subject.
Of course, thank you so much for your time today and discussing revision rhinoplasty.
Okay, thank you.